consultant obstetrics and gynecology, highest pregnancy specialist and laparoscopic surgeon at Sanior Hospital, Jankipuram. So as we all know, 4th of February is known as World Cancer Day, and the theme of this campaign this time is United by Unique. So let's get an understanding of it. So by United by Unique means this time the treatment of the cancer will be based on the personalized care of the patient, and the approach of the treatment will be individualized to the unique need of the patient. So why we dedicate a full day for cancer? Because cancer is a morbid disease, and on this day what we can do is we can increase the awareness towards the cancer, the early diagnosis and the treatment, leading to good outcome and prognosis of the patient. So we are doing this time. So as a gynecologist, today I'll be talking about the two most common and most important cancers in females. The first one is breast cancer and the other one is cervical cancer. So if I talk about breast cancers, there are risk factors which are not preventable. There are few risk factors like gene mutation, BRCA1/2 gene mutation, the genetic familial tendency of breast cancer in relatives, the advanced aging, the early menarche, late menopause, the previous precancerous lesion in breast. These things are non-preventable, so we can't do much about it. What we can do is there are risk factors which are actually changeable, through which we can prevent development of breast cancer in advanced age. Those are weight, like obese patient towards the menopause. If the weight is more, there are more chances of development of breast cancer. So yes, by increasing physical activity, changing our lifestyle and diet modification, quitting smoking and alcohol, increasing physical activity, do not prolong treatment of oral contraceptive pills for more than 5 years without consultation of your gynecologist, taking intake of hormone replacement therapy during the menopausal age for a long period of time. These things can lead to development of breast cancer, but these changes you can make by getting aware of these risk factors. So how do we screen? First and foremost, we will be talking about what is the importance of screening of a cancer. So by screening, what we can do is we can diagnose before the disease sets in, before the cancer sets in, before the signs and symptom of it. We can diagnose the cases early, and that will lead to a good outcome, a better prognosis and a better survival of the patient fighting with cancer. So this is why we included screening test in most of the cancers. So for CA breast, it is advised that the girls who are more than 20 years of age, they should go for an annual breast examination, and after 40 years of age, they should go for a mammogram every 2 yearly, which is an X-ray of the chest, which can diagnose disease, a cancerous lesion in your breast earlier, rather than diagnosing it in a later stage. When there are significant difference in your breast, there is discharge from your breast, or you can feel or palpate a lump in your breast. We can screen it in earlier age by this mammogram. Then let's talk about cervical cancer. So in cervical cancer, the most importance of this cancer is we have a vaccine to prevent this cancer. The vaccine name is HPV vaccine. So it is recommended that girls between 9 to 14 years of age and women who are in reproductive age group, they should take this vaccine and they are taking this vaccine before the pre-exposure of this HPV virus, then the chances of developing cancers, precancerous lesion and genital warts are reduced by up to 97%. So I request all of the women along with their daughter, they should come to the hospital and get themselves vaccinated. So between 9 to 14, the dose is just 2 doses of HPV vaccine, and in reproductive age group, after the exposure of HPV vaccination, yes, you can take this vaccine and the dose will be 3 doses. So let's talk about the screening of the cervical cancer. Again, the screening signifies early diagnosis and an appropriate treatment towards the illness, towards this cancer. So up to 21 years of age, there are no recommendation for cervical screening. Between 21 to 29 years of age, a test called pap smear, or you can go for a liquid based cytology every 3 yearly till the age you are 29. Every 3 yearly the cervical screening is recommended. Then after 30 to 65 years, till 65 years, you can go for a cervical screening every 3 yearly, or you can go for a co-testing with along with HPV virus. That will be done every 5 yearly. So, and after 65 years, if all the tests came out to be non-suspicious, that is negative, you don't need further testing unless there is any symptoms, or otherwise there are few cases in which screenings can go on if the few tests came out suspicious or positive and there was no treatment recommended for it, we can further screen the patient. So with all this information, I wish all of the women to be aware of the cancerous lesion, to be aware their daughter, and I wish you all a happy, safe and a cancer-free life. Thank you.